Finance and Budgeting Committee meeting for Monday, December 4th, 2017 is called to order. The clerk will please call the roll.
Calling the roll, Mr. Miller.
Here.
Mr. Jones. Here. Ms. Simon. Here. Mr. Hairston. Mr. Hairston is absent at the moment. Mr. Gallagher. Here. Mr. Schron. Mr. Schron is absent at the moment. Ms. Brown. Here. We have a quorum.
Thank you very much. Has anybody signed in for public comment related to the agenda?
Yes, Ms. Aaron.
Good afternoon.
Okay. Good
Welcome to
afternoon.
the committee.
All right, good afternoon. Many of you may remember, my name is Gloria Aaron. I have been an advocate for close to 40 years for our public hospital, Metro, and also over 20 years a patient. And I'm alive today because of the quality of care that you get at Metro Hospital. I've had 2 major knee replacements and open heart surgery. I think that we, as Cuyahoga County, should be very proud of our hospital. We are one of the few that have a community hospital, and we need to cherish it, and we need to remember that it is an excellent facility. No other system, the clinic or university, is one iota better than the service you get at Metro Hospital. I think we are here today because on the agenda, you will be voting to do a subsidy. I'm assuming the subsidy will probably be the same as last year. Of course, as a patient and an advocate, I think it should be more, but I understand you have to share your dollars. But I think you have to remember that we are in trying times. This morning when I was watching CNN and MSNBC, it's not clear what will happen to Medicaid and all the programs. What is the future? In Ohio, we have over 700 people that are dependent on Medicaid. If we lose that, and people have to go back to no insurance, or just what the fools have passed already saying that you don't have to have insurance. Well, people are going to get sick, and when they get sick and they have no health care, one of the first places they go is Metro Health. Metro Health still today takes the most Medicaid and uninsured of all the different systems in Cuyahoga County. We need to make sure that we are protecting it. We need to make sure that we don't know what's going to happen on the federal and state level, and we have to push all parts of our government to ensure that that stays a vital and stable hospital. So I hope before we leave here today, we will hear a commitment. We know we have one from Dale Miller, but from every one of you, that you will make sure that Metro gets its subsidy and that you will be there for them whenever they need financing, because there is nothing more important in this county than the health care and well-being of our citizens. And Metro takes that very seriously and never turns anyone away. Thank you.
Thank you very much. Councilman Schwan has joined the meeting. Has anybody else signed in for public comment?
Yes, Ms. Long.
Okay. Good afternoon. Welcome to the committee.
Mr. Chair, thank you. My name is Gail Long, and I'm a constituent of Ms. Brown, and a constituent of all of you in Cuyahoga County. Like Gloria, I have worked to maintain the public stature of our hospital, Metro Health, for many decades, and I take our work seriously in terms of what are the things that a community can do to maintain the stability of that institution. So I am a member of a group called Northern Ohioans for Budget Legislation Equality, and most of the work that we do is at the state level. So when Medicaid expansion was an issue several years ago, we worked very hard on that because we knew that that would have a huge impact on Metro Health. I am very concerned about what's happening at the national level. When driving in today, I heard one of the commentators say that they thought that the deficit strategy at the Senate level was being done intentionally, and that it would then give them the ammunition to deal with the entitlements, in particular Medicaid. If that happens, we all know that it will have a huge impact in our county for residents as well as the institutions, and not just Metro, that accept patients who have Medicaid insurance. So I think that it's imperative that all of us, whether we are policymakers, elected officials, or citizens, stay on top of those issues because it will have an impact on our hospital. I am now, after many years being a Kaiser patient, now I straddle two systems, but I'm also a Metro Health patient. And I go to primarily to care at the Severance facility. I don't know that they call it Severance, but that's what I've known it for decades. I've noticed that when I first started, when it first became Metro Health, I was like one of just a handful of people there. I was just there last week and there were lots of people there. So it's now known, people are going there for services, and it provides basic primary care in addition to many of the specialties. And it has an emergency room in an area where there is no emergency room, and I've been to that emergency room in the past, and it's a good facility, and I think that Metro has made some recent improvements to it. So I have said pretty freely that if you want to raise my taxes to make sure that Metro Health is supported, be my guest. I mean, that institution is perhaps one of the most important ones in the county. Now, Gloria and I have not always agreed with what goes on there, and we're not afraid to open our mouth. But at the same time, I think that under the current administration, you have people that are committed to serving all, regardless of their ability to pay, and will continue to do that. And I think we have a county council that has been supportive of them, and I hope that you will continue to do so as you go through your budget deliberations. So I thank you.
Thank you very much. Anyone further?
No, no one else has signed in. Let the record reflect that Mrs. Baker and Mr. Brady are also in attendance.
Thank you very much. And the next item on the agenda is the approval of the minutes from the November 20th, 2017 meeting. Those minutes are in your packet. Is there a second? Okay, it's been moved by Ms. Brown and seconded by Councilman Schron, and that is to approve the minutes for November 20th, 2017. Any further discussion? Hearing none, all those in favor say aye. Aye. Any opposed say no.
Abstain.
One abstention? Okay. We have more than enough votes to pass. Okay, thank you. If there is no objection, I would like to start with Resolution 2017-0227. Hearing none, please read that item into the record.
Resolution number 2017-0227, approving the Metro Health System's policies and procedures to participate in one or more joint purchasing associations for the purpose of acquiring supplies, equipment, and services provided through joint purchasing arrangements in order to achieve beneficial purchasing arrangements for the year 2018.
This is a very routine item. Metro Health needs an annual approval from the legislative authority to engage in these joint purchasing agreements, which allows them to obtain some economies of scale and save money. We have asked, and we would we would give an ongoing approval if we could, but we've asked and we've been told on numerous occasions that we can't do that and we have to provide this annual approval. So here it is, and I would ask my colleagues if anyone has any questions. Hearing none, since it's a month following next Tuesday's meeting, I would suggest that any legislation that we support, that we recommend for second reading suspension. Is there a motion to recommend 2017-0227 to the full council? And that's on second reading suspension? Okay. Any further discussion? Hearing none, all those in favor say aye. Aye. Any opposed say no. Resolution 2017-0227 is recommended. Resolution 2017-0226.
Resolution number 2017-0226, approving the Metro Health System year 2018 budget in accordance with Ohio Revised Code Section 339.06D, with the understanding that the allocation of county funds to the system will be made through adoption of the 2018-2019 biennial operating budget and capital improvements program for 2018.
Okay, as read in the statement, the actual approval of the county subsidy is done through the operating budget, and last week the committee of the whole recommended to the full council a version of the budget that includes the subsidy for Metro Health at the full amount, the same as last year, and that resolution will be up for final passage at the council meeting a week from Tuesday on December 12th. But in addition to that, the council is also required to separately approve the Metro Health budget, and that's what we're here for this afternoon. And I would call upon Dr. Boutros to please present the budget.
Thank you, Mr. Chairman. This is an opportunity for us not only to present the budget, but to give you an update of where Metro Health is and what we're anticipating for in the future. First, let me thank the entire council and this committee for the support over the past 4 years that I've been here and years prior. Also, your approval of the new board members and the re-election of current board members. That's been very helpful to us. Metro Health has experienced significant growths, and as you will see through the program, and honestly, that would not have been possible without your commitment and support of the health system. If it's okay, I'm going to be using the presentation that was handed to you, and it will also be available in overhead. Just as a reminder, Metro Health is 180 years old. It is the oldest healthcare institution in Cuyahoga County. It is the second oldest institution, with the exception of the predecessor of Case Western Reserve, in the entire county. So we were formed for the cholera epidemic and have continued to deal with crises throughout our entire history. We formed the first medical staff. We got affiliated with teaching and a School of Medicine 104 years ago in 1914. By 1937, the Metro Health System was the country's 6th largest hospital with 1,650 beds. That was during the TB crisis. And then we became the 3rd largest hospital in the country to deal with the polio epidemic. And Dr. Frederick Robbins helped formulate a polio vaccine, and that was discovered at Metro Health. In 1958, Metro Health became a county facility with a transfer of all the assets from the city of Cleveland to Cuyahoga County. In '89, the Cuyahoga County Hospital System became Metro Health in name. We opened the Critical Care Pavilion in 2004 and the Senior Health and Wellness Center at the South Campus in 2007. And we've been also one of the pioneers in patient-centered medical home for the past 10 years. In 2013, the Board of Trustees decided to go through an operational, organizational, and economic transformation, and they asked me to help lead that project. Critical Care Pavilion was built in 2016, and offering state-of-the-art facility and also housing our Ebola and Emerging Disease Center there. And in May 2017, thanks to all your support, Metro Health issued $946 million in bonds, which is the largest self-funded public hospital project in the history of the United States. That's with your support of the letter of credit to help backstop the debt service reserve fund. We are sure to move through this process expeditiously in the next 4 to 5 years. Again, in 2012, just want to let you know, about 80% of the population was within 10 minutes of a Metro Health facility. That number, and as of 2018, will be 97% of the population of Cuyahoga County. We aim to serve and be available to everyone in Cuyahoga County. We had, in 2012, 40% of the population within 15 minutes of an inpatient facility. That number will go to over 80% with the opening of Cleveland Heights inpatient facility and the Parma inpatient facility. So, and we've increased many of our available sites for care. We also increased the number of emergency departments from 1 to 4. The number of pharmacies from 3 to 9. That number may go up to 12. And we increased our outpatient visits from 875,000 in the year 2012 to 1.3 million expected in 2018. And we've increased the patient base, the people we take care of every year, from 180,000 individuals to 300,000 individuals. We are continue focused, as both Gloria and Gail spoke about, is our mission, fulfilling our mission. And these are just examples of some nationally recognized programs. In opioids, we expanded our Project Dawn across Cuyahoga County. We opened medical assistant treatment programs due to the increasing needs of opioid addicted patients. We launched the first Office of Opioid Safety and received a $2 million SAMHSA grant to help support that. And we partnered with the Cuyahoga County to develop Know the Risks program. We've done similar programs for infant mortality. I and the CEO of Rainbow's Children co-chair the First Year Cleveland, and we've started Nurse Family Partnership Program and also the long-acting reversible contraception program. In education, we've partnered with CMSD across 22 schools. We've also started the Lincoln West School for Health and Sciences, which became the first high school inside a hospital in the country. We've continued to focus also on additional services for our patients. There's our social determinants of health. They're not the medical determinants. Example, the VITA program, and we've also expanded to food as a prescription item through the Metro Health Pantry. Our community benefit for, and we have only the latest data for 2016, has gone up from $180 million to $226 million in 2016, with 78% of the dollars, $176 million, going directly to patient care. $45 million going to education and research, and about 2% for health programs. And you compare this to the average U.S. hospital spending for community benefit, it's 8.6%. where Metro Health is 22.2%. So for a similar sized hospital, and this is really important, Metro Health generates $140 million in annual community benefit above of the typical hospital in the United States. These are all non-for-profit and governmental hospitals. So we provide for our size $140 million more than the typical hospital. $32.5 million of that comes from your Health and Human Services subsidies support. The remainder comes from efficiencies within the health system. And this is really important because if you look at even the 8% that U.S. hospital average provide, only half of that goes to patient care. For us, it's 78% of the support goes to direct patient care. Some folks have asked, with our expansion, are we really taking care of patients who are in need? All of these patients, all of these dots are patients who are on Medicaid or uninsured. There is no place, with the exception of Metro Parks, that are going up and down, where we do not have patients who are in need. So these are individuals who needed the county support, and every dollar you gave us goes into a special bank account that only goes to the direct payment for care for these patients. Doesn't go for overhead, for salary, administrative salaries, or investments in the organization. It goes directly to pay for the medicine and the doctors and nurses to take care of these patients. Metro Health has grown quite a bit. We've hired almost 1,400 people since 2012. That's $100 million more in annual payroll for people of Cuyahoga County. We've increased the number of nurses, physicians, residents, and other employees. Our inclusion and diversity has been recognized nationally and regionally. And in 2016, 40% of our hires for management were racially, ethnically diverse or veterans. So Metro Health is committed to 4 areas as the industry is changing. One is lower cost. Consumers, employers, insurers, as yourself, are looking to make sure that healthcare costs are contained. Metro Health has been very aggressive in that and helping patients stay out of emergency room and reducing the need for hospitalization. That reduces health care costs significantly. We've also are committed to providing modern care that is shifting to the outpatient side due to the technology, and also increased demands for convenient, affordable, and accessible care. Today, 98% of Metro Health patient care is delivered in an outpatient setting. 98% of the care we provide is done in an outpatient setting. There's also an industry trend to move from volume to value, and we have led those programs, and today 45% of Metro Health's unique patients are within risk arrangements. That means we either make additional dollars if we keep people healthy, or lose dollars if we do not keep them as healthy as before. We have to constantly improve their health each and every year to receive additional dollars. We're also focused on wellness and prevention. These new delivery models that are effectively preventing illness are a core component of our population health program. We have built a foundation that is built on evidence-based medicine and efficient use of resources. Metro Health's 2016 Medicare Shared Savings Program achieved the highest savings in Northeast Ohio for any of the large health systems. We achieved 9% lower costs than Medicare anticipated compared to others in our area who went up by 3% higher than anticipated or 4% lower than anticipated. So Metro Health did incredibly well. So you also heard from the testimony of people worried about the risks for Metro Health. We worry about it too, on the national and state level, but there are really also some other opportunities that we're looking forward to. So tax reform would eliminate tax-exempt bonds for future use or refinancing of the current bonds, and would also create a 4% payment cut to Medicare. We are currently working on and I'm going to visit our congressmen and our senators on Wednesday in Washington, D.C. to discuss about reducing the impact of the tax reform on hospitals like Metro Health, county-owned facilities. There's a possibility that they're going to continue the Medicaid and DSH and hospital UPL cuts. These are all impact Metro Health, and we're working with the senators to advocate for a multi-year extension to CHIP that would include putting off the DSH and Medicaid cuts that are considered. Through the 340B program, if they reduce that or they repeal it, we would not be able to provide many of the medications that we currently do to patients who are underinsured, and also the one that we utilize that program in our jail services and saves the prescriptions of about $500,000 a year. We are advocating to exempt Metro Health from these cuts, or hospitals like Metro Health, safety net hospitals like Metro Health. Again, there are some other issues that we look at. All of them, we have strategies to mitigate those risks. So in creating the 2018 budget, we needed to perform to what we told the bondholders and others who invested on us, and that we targeted an income of $40 million. That would be an adjusted EBITDA, or earnings before interest, depreciation, and amortization, effectively operating cash flow, a target of $97 million. We wanted to enhance access with new community hospital, ambulatory sites, and freestanding emergency rooms. We looked to the service line structure that we implemented 2 years ago to increase patient experience outcomes. We also wanted to decrease inpatient utilization with the movement to population health management. We expect some growth in value-based payments from successful management of risk arrangements. We have anticipated some of the federal and state reimbursement cuts that have been already proposed before the budget. And we also are looking for transformation cost containment through operational efficiencies. So just to go over our operating performance and to put it in different perspective, Metro Health in 2017 expects to have an operating performance of $256 million if we did not have any community benefit or other programs. So this is enhanced access and expansion of our programs, value-based payments, 2 new inpatient facilities, and those transformational cost containment programs that I'm talking about. That would then be offset by $194 million for care, $226 million of community benefit that is offset by $32 million of health and human services levy support. There is another $22 million of anticipated cut in the budget, and that would bring Metro Health's operating income to $40 million. So if you look at the operating budget in 2016, we achieved an adjusted operating income of $22.8 million, $22.7 million. Our trailing 12 months, this is for August 2016 through July 2017, the month immediate to the budget formulation. The trailing 12 months has an operating income of $39 million. 2018 target is $40 million with a 1.157 billion, in total revenues and 1.117 billion in total expenses, resulting in $40 million. However, you will see that if some of all the introduced changes in state and federal programs occurred, Metro Health would go down to $8.7 million. Operating income would go to $8.7 million. If some of those were mitigated, Metro Health income can go up to $50 million. For example, we counted on 5% state Medicaid reduction, and that number has been reduced to 0 for the January to July timeframe by the state. They may revisit it once again for July to December, so it may come back. If you look at Metro Health's operating revenue, and we started this, and if you may be wondering why this length of time we show that, I actually started delivering this data to you in 2013, with the year I came here, right? So we have it from the year before we started the transformational program all the way to date. And you can see the Medicaid waiver had an impact of about $70 million improvement in our total operating revenue. Then we had our managed care contracts. We focused on that, and that resulted in another $50 million improvement. Contracts and facilities increase had another $30 million improvement for us. And by the incorporation of HealthSpan, we had $100 million of new revenues. We continued to have growth through the different programs, and $60 million, and we expect to increase by another $50 million due to the enhanced access and the new sites. So that resulted in a trailing 12 months I discussed. I just would remind you that in 2012, Metro had a $10 million in operating income, and during the first 3 months of 2013, had $6.5 million loss in income. So operating performance is used to generate the cash flows to meet our debt service requirements. The trailing 12, you can see that number has increased from 54 million to in the mid-90s. And the Sirius 2017 bonds that you approved require us to have $64 million, and which are maximum annual debt service. And as of today, we need an additional $20 million for ongoing investment in facilities and operations. So the vast majority of that $97 million goes to these areas. And our unrestricted cash and investment has been growing since 2012 from 286 to now. In 2018, we expect it to be end the years around $440 million. That does not include the money that we have from the bond, which is not unrestricted. It is restricted funds, and they're kept in a separate account and cannot be used for any reason except to the transformation. That's my testimony, Mr. Chairman. I'm happy to entertain any questions.
Thank you very much, Dr. Boutros. I'll open the floor to questions by my colleagues. Ms. Simon.
Thank you. Thank you, Doctor, for the presentation and for the good job you are all doing at Metro. You indicated that the patient base has increased significantly over the last couple years, I think. Is that due to Medicaid expansion? No.
No, so actually, if you looked at our increase in patient base, our Medicaid patients, I think, increased by, with expansion, increased by, and new locations, increased by 30,000. So if you would add 180,000, you add 30,000 to that, that would give us to 210,000 patients. The remainder, the 90,000 patients that we picked up, were Medicare and commercial patients by having our locations all over the county.
Any other questions? Vice President Jones.
Thank you, Mr. Chairman. Again, thank you, Dr. Boutros, for the presentation and the continued good work you're doing at the hospital. Let me first just say I'm glad that this council was able to restore Metro to our county jail for the great work you're doing there as well. More of just a general question. Tell us a little bit about the transformation process and how things are going with that.
Can I talk about the jail for a second?
You certainly can. Feel free.
So we've tried to stay out of the public discussion about the jail. I have to tell you, I was pretty concerned about the coverage of what the county council was trying to do and how it was portrayed in our publications. It was portrayed as if the council was spending more money than it needed to support Metro Health. That is not the case. Metro Health continues to deliver significant improvements and I think Councilman Gallagher, as the chair, recognizes that. We've reduced, according to our numbers, we've reduced the transportation that you used to have from the jail to a hospital by $800,000. That does not get counted in the budget. You would have two sheriff's officers transporting patients to the hospital, right? We've reduced that by $800,000 by actually being here, so you don't have to do that. We've also, the savings of from 340B account for another $500,000. And you have the world best electronic medical record to take care of patients, which you would not have with the exception of Metro Health. The Epic electronic medical record, we are the first organization to ever put it in a jail or a facility, or a correctional facility. The president of Epic had already made a decision not to do that. We convinced her to let Metro Health be the first organization to do that. Finally, we began opioid treatment in a jail, which are, again, services that I think would have to be covered outside. So from our point of view, based on our analysis, if you look at the overall cost of the program, you're still continuing to receive incredible benefit from Metro Health. So I do appreciate the support tremendously for having Metro Health continue as the provider for the jail. I would just say to you, I think it was spun that you are actually giving more money to Metro Health than you would have spent on other provider. That is not the case from our point of view. So thank you for giving me the opportunity to address that. The transformation project is going really well. We have 40,000 square feet today that are known as the big room, and I will invite you all to attend to that. It is a unique way of designing the project. It has all our architects and engineers here on site 24 hours a day, 7 days a week. They don't go home. It has our construction managers on here. It has our project managers. They all work together collectively to reduce in cost. It is expected that approach to it would cost somewhere between 10 and 15% lower than the standard way that people would do this. You eliminate over 95% of change orders because you design it right the first time, so you don't have to make any change orders. And you actually impact time to completing the build. So every year, every month we save in having the hospital and the other buildings completed earlier is about $4 million worth of savings because of cost of goods and cost of labor. So the project is going well. We are finalizing what we are calling the site development. Clearly, we showed you some examples of what it could look like. It will look very different. I think we are hoping to become the first hospital eco-district, and I'm happy to send you information about that in the country. That means we would not only transform our hospital, we transform the community around us. So early January, we'll have the ability to show you what we think we're going to look like and what the programs are going to be available for the folks in Cuyahoga County. On the diversity side, there have been diversity involvement all at each level, including at the construction management level. I think they will have 5 subcontractors that are both FBEs, MBEs, and SBEs. And so I think we'll have significant diversity. We hope that's the benchmark that everybody uses for diversity in projects in Cuyahoga County.
I'm glad to see those numbers. I will say one thing on your employee diversity page where it says 2016, 40% of all hires were racially diverse and/or veterans. I like to see it sometimes without the veterans, so just so you can see clearly.
It's about 1.5% to 2% veterans.
That's the difference.
Yeah, so you would see it at the same amount. It wouldn't change, about 39.5% without the veterans, and I think it's 41% with the veterans.
Okay, thank you.
And some of the veterans happen to be African American,
Minorities,
Latino, and the
right.
like. So
Councilman Tran.
Thank you, Mr. Chairman. And I too am pleased to know that you were in this proposal of the budget, stay part of the jail service out there, because I think universally disappointed when we saw that was being recommended out there. So the paying percentage of patients, how has that changed, and where are you as a total percentage of your population?
yeah, so I think you're looking at the number of people who are uninsured. That what you're looking at?
No, I'm looking at, you say you now have a higher percentage of paying patients, I think,
Yeah.
meaning insurance programs, or I assume, yeah.
So,
How's
so
that changed?
if you think about it this way, commercial payments usually cover more than the cost, right? And commercially insured patients are the ones who subsidize the care and the cost of care for uninsured patients, Medicaid patients, and even in some cases, Medicare patients. So the percentage of Medicaid and uninsured combined, which is what we consider uninsured and underinsured, today about 50 to 52% are in Medicaid or uninsured. The remainder is split equally between Medicare and commercially insured patients. So, but you think of that as a number that used to be as a percentage of 180,000 patients to now being a percentage of 300,000 patients, right? So our commercial patients, I think, increased from 21% to about 25% of our patients we care for. That's the patients who pay the highest amount, the commercial patients, from 21% to 25%. But it used to be 21% of 180,000 patients. Now it's 25% of 300,000 patients.
Well, so that would, let's see, if you bumped it from 21 to 25, if I understood the numbers,
Yeah.
that's a 20% increase in paying patients. And
That's right. And they offset the Medicaid.
right, okay.
Yeah.
Would there be a commensurate, if we looked at the numbers of, and I don't want to necessarily competitive, but the other hospitals in town, would they have lost that same so where's the paying patient coming from that you're picking up?
Yeah, so because they're much larger, their reductions are, and they actually provide services outside of Cuyahoga County. You would never see it in their numbers. So I don't know if they analyze their numbers by only Cuyahoga County. Only we do it because that's where we operate. So I don't know if they could vet it out through their numbers.
Okay, so that the natural thing that happens in business where one person loses and the other one gains, that
They could have lost it in Cuyahoga County and have gained it outside of Cuyahoga County.
okay, so I just worry about whether or not they're going to compete with the competitive strategy that goes after those patients that they've lost. If it's so insignificant to their numbers,
Yes,
then they're not going to worry, they're not going to lose a lot of sleep over it.
no.
Even though the impact on you is pretty significant to have.
No, they lose sleep over it, and yes, there are competitive strategies
Okay,
for those patients.
okay. And then on the transformation, on the big room, is that a physical room or a digital room?
No, it's a physical room. And it also has digital that has visual reality. So our employees will, as we design these facilities, will actually be able to walk virtually through them and tell us how to change the facility so that we can design it virtually first and then physically. And there are also, it's the room that has the models. So we create the models out of cardboard, out of each room, so that our staff can work through it and say where the best placements of things are.
Will it be digitally available for the community and the public to look at and watch it? I mean, kind of like
Yeah.
what the treasurer is doing with the open checkbook for everybody to be able to look and see how the monies are being spent?
We're actually looking to have that a part of our space in the Global Center for Innovation. We have a table that actually will be able to have people look at and be able to see and be guided through the process. It is not something people should do on their own. They just won't be able to see what they're looking at.
Okay, they're just going to be too complicated for the average person to see what's going on with the hospital.
Right.
and what
So
it's supposed to-
I think when we finish the design, we'll be able to put that on our website and have people do a virtual tour through the hospital, and that will be available, I would say, in about 15 to 18 months. So that part will be available, but in the meantime, the specific pods and units really need some guidance through that.
Okay, so, and you're using the design build concept for construction is what it sounds like you're doing.
A little even more advanced than that, Mr. Schron. But yes, it picks up on that.
I'm thrilled because that was one of our first pieces of legislation we got through, was to use design build in the county. Thank you.
Anything else? Ms. Baker?
Thank you, Chair. Just a question on your employee increase over the years. Is there a reason why, especially when we see that 98% of Metro Health's patient care is delivering in outpatient settings, why the nurses aren't being perhaps expanded upon more, given their level of education, the things that they can do, they're a little more flexible in reaching out? Why is it?
My apologies. That's only 1 year. If you looked at during the entire period of time,
Okay,
40% of those folks were nurses out of the 1,370.
oh,
Okay, so this just happens to be an increase in 1 year, and the latest year. So
okay. Can I?
we had invested so much in the nursing staff because they were short-staffed when I got here,
Right.
that during the prior 4 years, we had some significant increases in the nursing staff.
So no need to increase for this current year, given your expanded footprint?
No need to increase for 2017. We hired, for example, in 2016, I think overall we hired over 250 nurses in 2016 in anticipation for 2017.
Okay, good, thank you. Good to know.
Just while we're talking about nursing, you should feel incredibly comfortable with our nursing staff. We received our third 5-year magnet designation that puts us up in the top 8% of hospitals in the country for nursing care. And last week, our nurse orientation program has a specific name in that we actually give them a residency, a nursing residency. It just got approved last week with distinction, and it's the first approved nursing residency program in the Midwest. First one in Ohio, the first one in the Midwest. So you can rest comfortably that we take care of our nurses and make sure they're well-trained and there's enough of them.
May I just follow up? Is your nursing staff primarily those that go out to the community and deliver the outpatient services?
Nursing staff are a very important part of that program, but we have pharmacists, social workers, doctors, PAs, all sorts of folks.
Okay, thank you, Chair.
Anything else? Council President Brady.
Thank you, Mr. Chairman. Just want to congratulate you on these last 4 years, really having watched it all fairly close up. You've really breathed new life into our public hospital and really put it on a trajectory that we can be confident that it will be able to provide services for people in this county for many years to come. So thank you for that leadership. I didn't want to distract the conversation from the bigger picture because I think probably this discussion might be better had in maybe in a different venue where there was more time to focus in on it. But I wonder if you could just say a few words about the potential for community and economic development in the neighborhood of the Metro facility.
Yeah, I think honestly it would require more time, but what we are trying to do through the Eco District is fairly extraordinary, which is create a self-sustaining community that does not need constant support and periodic support to be self-sustaining. So we're hoping to deal with education. We're hoping to deal with equity and economic development across the enterprise. We hope to deal with housing, all different housing, and our first project was, I think you were there, was the Lion Mills project, which is 36 low-income housing. So we want to continue to do all of that, and we'll be able to present that, and I think in the first quarter of next year, and to demonstrate how we're dealing with everything from access to the internet. Folks in our neighborhoods and folks in poverty don't have real access to the internet, so they can't effectively participate in the new economy. So we want to deal with that, to housing, to education, to healthy living with food and walking trails and all sorts of things. So I'm happy to come back and present that.
We'll look forward to that. Thank you.
Ms.
I just
Simon.
want to add, with all the success we had, honest goodness, your support has been an important and invaluable part of that. So thank you very much.
Ms. Simon.
Thank you. Just to piggyback on the nurse question, are your nurses coming from local students mostly?
Yeah, we Cuyahoga County is the vast majority of nurses in our organization, and I think, and I don't remember the exact numbers, but I would tell you is that, for example, African American nurses and Latino nurses, I think we have twice the rate of that of Ohio. So we have twice. I can't remember. One is 3.2, other one is 2.4. The number of average nurses in Ohio. So we are trying to look like the people we serve or the communities we represent.
What is the committee's pleasure regarding Resolution 2017-0226?
Looking for a motion?
Yes.
To approve with second reading suspension?
Yes.
Yes, so moved.
Is there a second? It's been moved and seconded to recommend Resolution 2017-0226 to the full council with recommendation for second reading suspension. Any further discussion? Hearing none, all those in favor say aye. Aye. Any opposed say no. The ayes have it. Resolution 2017-0226 is recommended. Resolution 2017-0232.
Resolution number 2017-0232, authorizing an amendment to contract number CE 160027-0-01 with Highland Group Incorporated for insurance brokerage and risk management services for the period 1/1/2017 to 12/31/2017 to extend the time period to 12/31/2018 and for additional funds in the amount not to exceed $1,445,000.
Who from the administration will present this legislation?
Chairman Miller, it doesn't appear that someone's here to present the item from the administration.
Who from the administration would normally present the item?
I would typically assume it would be Darlene White, potentially from Risk Management.
Can we contact her and see if she's available?
We can try.
We'll be in recess for 5 minutes, and we'll see if we can. Normally, I would just say we'll hold it, but we want to try to get work done before the end of the year if we can. Okay.
This wasn't scheduled, this meeting?
I'm very surprised. I mean, this is.